everyone, my name is Martha. I am a relationship counselor and clinical sexologist. I have been in practice for 12 years, working with individuals and couples with sexuality and relationship challenges. And in the last 2 years, I've started to work with Disabled People's Association, running virtual and in-person workshops around sexuality. So today's session is more on sexual health and wellness. Okay, so today the topics that we'll be covering. The first one is puberty. What are some of the changes that happens when you come of age? This usually happens around the age of, can start from 13 to 16 onwards. So essentially, this is when your body is developing and growing, and you are maturing to be an adult. So we're to be talking a little bit about the changes due to puberty, including masturbation and menstruation, sexually transmitted infections, contraception, how to have safer sex, and different ways to have safer sex as well, including devices that can help people to have safe and pain-free sex. So what is sexual health? Sexual health is more than just healthy and being okay. Sexual health has to do with physical, emotional, mental, and social well-being relating to sexuality. It's not just the absence of illness and this disease. It has to do with being happy and positive. So it requires a positive and respectful approach to sexuality and sexual relationships. Just because somebody is not sexual, it doesn't mean that they cannot have a very positive attitude around sexuality. And it needs to feel pleasurable, feel good, feel safe, and also free of coercion, discrimination, and violence. And this is a list of sexual rights that we are supposed to have. So there are 13 sexual rights that I have listed. The first one being sexual freedom, sexual autonomy, sexual integrity and safety of body is one, sexual privacy, sexual equity, sexual pleasure, emotional sexual expression, sexually associate freely, make free and responsible reproductive choices, access to sexual information based on scientific inquiry, comprehensive sexuality education. 11 and 12 is repeat, and then there's sexual health care. So these are some of the rights that we are supposed to have with regards to sexuality. However, as we know, we don't live in the perfect world, and what we deserve sometimes is really lacking, and it's really important to get as much information as we can around our sexuality so that we can make more informed choices. So here are some myths. There are 6. The first myth is that children with disabilities have more important things than sexuality to worry about. True that in life we have many things to worry about or to learn, to be busy about, including life skills. However, our sexuality is a part of us, and we can feel different in our body. As we get older, we can feel sexually aroused and horny, and we may want to navigate life as an adult. So sexuality is not just about having sex. Sexuality has to do with our thoughts, feelings, and behaviors around being a sexual person. So people with disabilities definitely need to have more information and knowledge so that we can make the best choices for ourselves. So it is not true that this is something that we don't have to worry about. That is not true. Second myth, people with disabilities do not need sex education. It's not true, because just like anything in life, we need to learn so that we have the information, knowledge, and resources. So people with disabilities are also people, and we need to learn so that we know what is best for us, and we can make the decisions for ourselves. Number 3, children with disabilities should only have relationships with other people with disabilities. I know of a lot of people with disabilities who are in schools with other people with disabilities, And so that is their circle of friends. But it is not true that people with disabilities should or only have relationships with people with disabilities. It's definitely not true. The world is made up of all kinds of people with different abilities. And the world will be a very lonely place if we just segregate people like this. So it's not true that people with disabilities should stick with people with disabilities. Okay, number 4. Talking about sexuality will give them permission to be sexually active. I think this is still continuing. Actually, this is a myth that is still continuing in Singapore. A lot of parents want to protect their kids. They are very worried about talking about this topic because they themselves are ill-equipped to talk about sexuality. In reality, talking about sexuality helps us to become comfortable with this topic, to be able to stand up for ourselves, to be able to make better choices. Because if we don't talk about something, we may feel uncomfortable with it. And that is actually also a gateway for sexual violence and abuse because we are so uncomfortable about it. Some of you may know about all the media reports that are coming up about sexual violence. And that is what I consider the dark side of our sexuality. There's the good, bad, and ugly. And as a society, I feel that we don't have enough channels and platforms to talk about sexuality in a positive way. And so all these ugly side of sexuality is coming forward, partly due to the fascination that people have, partly due to the lack of resources and education so that people can make better choices for themselves. So I don't agree that talking about sex will actually make people more sexually active. In fact, it will help them to make better choices with regards to their sexuality. Okay, so number 5, my children do not want to hear this from me. I know this session is not for the parents, but this is for the individuals with disabilities themselves. So with regards to your parents may feel uncomfortable talking about this topic. Your parents come from a generation where they may not have heard about sexuality education. They may not have had much sexuality education from their own parents. So they may feel uncomfortable talking to you about it. Just because they're uncomfortable talking about it to you, it doesn't mean that it's not important to talk about it. So if you want to ask your parents, that is on to them to deal with their own discomfort, to get the knowledge and resources for themselves. You can always refer your parents to Disabled People's Association, where we are providing support for parents. But it is not true that we don't want to hear from our parents their opinion. When we talk to our parents about about sexuality, we can also hear from them their perspective and their values. Some of us come from different cultures and religions, and we do want to hear actually what our parents feel around this topic of sex and sexuality. So that's myth number 5. Okay, myth number 6, I have waited too long. Okay, this is again more the parents' myth. Some parents may feel awkward, and so the awkwardness talking about sexuality will just continue. So they may feel that they have waited too long, you already know everything, so no need to talk about it. It is not true. It's never too late to re-establish a good relationship with your parents, and it's also never too late to re-establish open communication with your parents around sexuality. When you yourself are uncomfortable, your parents will be uncomfortable. It's kind of contagious. So you have this curiosity around sex and sexuality. By all means, do try to get the answers that you deserve, because they are your trusted ones. They love you. They are able to support you. So if you don't bring it up, they may not know that you have questions and needs. So do bring it up to your parents, and your parents can also get support through Disabled People's Association. So these are 6 facts or myths that I've just gone through. Okay. So this is a cartoon that reminds us not all illnesses are visible. So in today's session, we have people of different disabilities. We have, of course, physical and probably mental. So I'm trying to cover as many of the relevant topics, bearing in mind people with different disabilities. So just bear with me if some of the things that I'm mentioning are not really related to your disability, but I think it's information that will be useful to all of us to become more knowledgeable and aware.